Good afternoon, everyone. Welcome to our School of Public Affairs, University of Colorado, Denver virtual event on police community relationships. I'm Paul Teske, I'm the Dean of the school, and we are delighted that you're here, and thanks so much for joining us. As we all know, there's probably no more important issue in our society today than police community relations. In the last month and more have featured protests all over the country, lots of important discussions about this issue, and as with many issues, we feel that the university is a great place to bring expertise, have neutral, objective conversations, and hopefully move these issues forward in important ways that help our society. My job today is just to welcome you and to welcome our moderator for today's panel. We're fortunate in today's panel to have two SPA faculty members, one SPA PhD alum and another distinguished guest who have a lot of expertise on these issues. Professor Mary Dodge is our moderator today. Mary has been with School of Public Affairs for about 25 years. Has great expertise in a range of criminal justice issues. She's frequently quoted in the media about police issues. She earned her PhD from the University of California, Irvine, one of the top schools of criminology in the country, and she's written award-winning textbooks and a range of articles on a range of topics in criminal justice. So we're looking forward to the panel discussion as well as your questions and participation on this important issue. So Mary, thank you very much.
Thank you, Paul. That was a nice introduction. So today, as you know, our panel is entitled, How Can We Improve Police-Community Relationships? Unfortunately, numerous tragedies have brought us together to discuss a wide array of sensitive, controversial, and difficult challenges. Our deepest sympathies go out to the friends and families who have experienced unimaginable losses during this time. Though as the title of our event suggests, there are solutions and positive movements occurring that can mend broken relationships. On June 19th, Governor Polis signed Colorado Senate Bill 20-217. This bill represents one of the first steps designed to enhance law enforcement integrity. Additionally, a number of reforms are taking place globally and nationally. So I'm Mary Dodge, and I'm a professor of criminology, as Paul said. I'm honored to welcome our panelists who bring important narratives and perspectives to today's exploration of policing and community relationships. These are both ongoing and changing narratives. So first is Dr. Jesse Lee. Dr. Jesse Lee is an executive consultant for Kaleidoscope Group and former executive director of the National Organization of Black Law Enforcement Executives. The Kaleidoscope Group and Dr. Lee specialize in collaboration and research with police agencies to improve and strengthen relationships with the community. Also, he has served on numerous national boards, too many to mention, but for example, Mothers Against Drunk Driving and the Community Policing Consortium. So Dr. Lee, thank you very much for joining us today. Next is Dr. Tanya Settles. She is the Chief Executive Officer of Paradigm Public Affairs, and I'm proud to note an alumni from our program. And Tanya, maybe 20 or 25 years ago, you were a student for me. But Dr. Settles has areas of practice that include police community relations, restorative justice, the impact of natural and human-caused disasters on at-risk and diverse populations, and also diversity and inclusion in higher education. Dr. Paul Taylor, he's a rock star, and he is an assistant professor of criminology and criminal justice at the School of Public Affairs. His research focuses on a wide range of policing issues, and his background as law enforcement officer offers a unique perspective on policing and public policy. Dr. Taylor has served on the curriculum committee for the Colorado Peace Officer Standards Training Board, as well as a wide variety of consulting roles with law enforcement. So thank you for engaging in this important topic today. After some initial thoughts by the panelists, I've arranged and integrated many of the questions that we've received from our audience. So I'd like to start. We see that the potential for social transformation, given these kind of events that we're experiencing now, offers a framework on how to promote change and achieve equality. First, I would like to ask each panelist to give a brief overview of their perspective on how and why police-community relationships are important or how they're changing. So it's a little bit open to our panelists to give us a basic perspective. And I'm going to start with Dr. Lee, if you could respond to this question.
Okay, again, thank you for this opportunity. I would say that we've been going through challenges for a very long time, and I think with social media, cameras, and everything else, it brings a lot of things to light. I think change comes about when everybody feels a part of the solution or part of the problem, that by standing by doing nothing, they feel as though that I start to see a change. So this was the first time. We've had plenty of videos of incidents occurring throughout the country, but this was the first video that actually talked about or was able to be seen from beginning to end of a person whose life was taken unjustifiably. There was really, we talk about mitigation of use of force, and it was the first time that I seen where you could see from beginning to end where there was no doubt in everyone's eyes. So it just went across the barriers, not only locally, but internationally as well, where everyone had a chance to witness this really tremendous moment. And I think it touched and crossed so many barriers that it just brought about change that I've never seen before ever. And we've had a lot of trauma. One life is too many, but this was a life that everyone witnessed, and I think that's what's bringing about the change. It wasn't about race. If you look at those who are protesting, it's across the boards, nationally and internationally. And I think it's about people wanting to make sure that this is a just, we all come together and with this cause.
Thank you. Dr. Settles?
Well, first I want to thank the School of Public Affairs for including me and including Paradigm in this important conversation. As an alum, I'm so grateful for the opportunity to reconnect with friends and colleagues at the University of Colorado at Denver for this discussion. So the challenge that I think we're really confronted with right now is one about making sense of the complexity of a problem in a way that we can no longer avoid viewing it. The problem isn't new, but we've sort of consistently pushed it a little bit to the back burner. And so solving this problem now really challenges the limits of the boundaries of democracy. And while these challenges are immense, they're not insurmountable. I have a lot of hope and great confidence in our democracy to meet these challenges, but I'm also reminded of what H.L. Mencken said: for every complex problem, there's an answer that is clear, simple, and wrong, and we can't afford to get it wrong this time. So we need collaboration on all levels of government. We need the help of Congress to fund key functions at the Department of Justice, the courts to rethink the role of qualified immunity, state governments to open pathways, as Colorado did, to pathways to reform through legislation. We need a closer examination of unions and the role of collective bargaining. And we need communities, we badly need communities to re-engage with police and support proactive and socially responsible policing. But more importantly, we need the police themselves to be open to reform and to rethink what their role is in terms of reestablishing trust and legitimacy and transparency, while they're still maintaining that essential role of crime suppression and creating communities where all people are free to live healthy and productive and safe lives. And so with that, thank you again for having us here. I'm excited to start our conversation.
Great, thank you, Dr. Settles. Dr. Taylor?
I want to reiterate the gratitude that the other panelists spoke about for being here and for being able to talk about these tough issues. I'm going to take a little bit different tack with the question. In 2014, I was the training manager for a Colorado Police Department. And during that time frame, I watched as Tamir Rice, a 12-year-old boy in Cleveland, was shot and killed by police. I watched Freddie Gray. I watched Michael Brown. I watched these incidents occur. And one of the things that stood out to me as a trainer who truly believed and wanted to prepare my officers to go out and do the job every day that they did, there was no way for me to learn about these incidents. There was no way to look at these incidents and understand systemically how they occurred and what brought these incidents about. And as a trainer, I felt powerless. I had to learn about these events and try and divine from these events how to prepare my officers going forward. And I think this speaks to one of the issues that we've had in policing, that as a profession, these issues, as Tanya and Jesse both pointed out, these issues have always been in place. They're suddenly more visible to the public. But the same systemic influences that led to each of these tragedies have been in place for a long period of time. I think the public is getting tired of seeing them. They're tired of incremental change. And let me be clear, law enforcement has tried to make incremental change, but one of the issues is that when you base incremental change on a structure that isn't stable or probably isn't adequate for what it is that we're currently doing, you're not going to get the type of change that's going to lead to better outcomes necessarily. And one thing I want us to be careful about as we have this conversation is to be careful about these generalized terms that we tend to throw around all the time, things like accountability, things like transparency, things like de-escalation and defunding. Community-oriented policing, they're folk terms in that we all know the terms, but we all have different meanings for them. And one of the issues that I've seen as we've tried to push forward reform efforts in policing is that there's a lot of frustration because there's a difference in understanding about what these terms mean. Every police department in the country has a de-escalation policy. Every police department in the country has a community-oriented policing policy. But what that means to practitioners may be very different than what that means to individual community members. And so I think a common language and a common understanding about the direction that we want our police departments to go, the roles we want them to fulfill, and then building the structures that we need them to have in order to fulfill those roles. And that's not just a policing problem, it's our individual communities. If you think about our healthcare system, it's very similar in that there are a lot of different hospitals. Each of them are run very, very differently. Each community needs to put the money and the effort and what they want into that hospital in order for it to be the healthcare facility that's going to support that community. We want some broad professional standards. We want professional learning, but it's going to be an individual community effort to get your police departments where you want them to be. And some of these broad strokes in the state of Colorado, we have agencies as small as 1 or 2 officers and as large as Denver PD. And the efforts that we put forward aren't going to be a glove that fits well for every community. And so it's on all of us to get involved with our local police departments and help bring about the changes that we want to see.
Great. So I have to say, the panelists, you have done an excellent job for starting out our discussion, because one of the things that you all mentioned and was a topic in the questions from our audience is community engagement, and this idea that Paul brings up about common language, which I think will thread throughout our discussion. So on community engagement, many of the questions, and I'll just give you some idea, people that our audience is interested in how citizens can engage in supporting this transformation that we might see, how they can do it in positive ways, working with the police, and how different groups, nonprofits, reentry organizations, and even museums can support improving these relationships. In short, what can community members do to assist with the reform? And I'm going to throw this out first to Dr. Lee, and then our other panelists can comment on this. But when we talk about community engagement, what do we mean?
Well, the first thing is have a common dialect so that everyone knows what we're talking about. We can provide law enforcement training, but if the community doesn't understand why that training is being conducted, there's a disconnect. If we know and we're a part of the development of the training process, not on the aftermath, but in the beginning, we look at the hiring practices of police officers. So if I'm a community member, I want to be engaged in what that job description looks like. So therefore, I'm in the beginning of the process, not on the end. The citizens always look at, well, we pay for the police department. I keep hearing this thing about defunding. It's not defunding, it's reallocation of funds. When we talk about reallocation of funds, maybe those funds can be allocated procedures where we get community involvement. We have students who are doing policy research, being engaged with law enforcement and assisting in developing those policies. So there's ownership, both from the community at large and the police department, because they're there. You hear about a lot of agencies who haven't updated their policies in 5-10 years, because if they're so busy doing the work every day to day, they can utilize the resources from the community, from the universities, no different than anything else. When we talk about involving more of your nonprofits, sometimes individually we feel though that we may not have the time to do everything we need to do, but if we work in a nonprofit organization or a community organization, we collectively bring our time together. So we know people have to balance their work-life, balance their family, but they still want to get involved with the community. So working with a nonprofit still allows you to get involved with the community, involved with the police department, and have a collaborative approach. One person doesn't speak for the whole community, so by having that voice collectively, engaging with a nonprofit organization will allow you to have a collective voice. Your voice will be heard. Museums, we know that history needs to be taught. And museums are who else is a better collection of our history, of all history. So a lot of times, the more we are exposed to through museums in a non-structured way where individuals get to go and learn, they get to understand some of the best practices out there around the world. What history has shown us in the past, that utilizing museums, where some young people may not have the curriculum in their schools, they may be lacking some of the history, they will be able to get from those museums. Police officers who may have a voice of making change may not have that voice at work, but by joining a nonprofit themselves, they can share that voice. And a lot of times those law enforcement officers work in nonprofit organization with community members, they have a better working relationship, and that will show as they work with the community overall. It just starts to begin that relationship.
Great, thank you very much. Any comments, Paul or Tanya? Okay, so another thing, and we'll get to defunding in just a minute because you did mention that, Jesse, but one idea is engaging in these critical conversations. They're not easy conversations to have. I feel that we've had this opportunity today, and that many police departments across the country and public organizations are doing this. But one of our audience, Wendy, raised a question. It's a complex issue that developed in a large state law enforcement agency. And she asked, what is the best way to engage employees in conversations about policing and community relations? Dr. Settles, would you want to take a first shot at this question, please?
Sure, I would love to. I love this question because it starts with the premise that there's not a single conversation, that there are many conversations. So Wendy, thank you. Thanks for sending this to us. So that first conversation is really a tough one, though, because it means that people within the department have to engage in some really difficult thinking about who they are and what their values are, both individually and organizationally, and what tools that they need to be the best that they can be for their agency or their department. And there are a lot of tools. Some agencies need help with things like managing privilege. Some agencies need help with better understanding the science behind bias and why that occurs. And in other cases, it means recognizing nuances from complainants that involve phenomena like profiling by proxy. So, you know, a lot of times police agencies call organizations like Paradigm or Kaleidoscope because something has gone horribly, horribly, horribly wrong. And there's been an adverse encounter, and the video hit social media or the press, And the first thing that the city does is they say, okay, everybody's going to get diversity and inclusion training. That's our first thought, because we need to fix that break, that fissure that occurred between the police and the community. But here's the thing about this. Here's a secret. Police officers are just like every other organization. They're like people who work everywhere else, and they're just like us, and they are about as excited about mandatory diversity and inclusion training as they are about having a root canal. And so they have the same response that everyone else does. But unfortunately, that conversation about how to engage with the community, how to recognize the differences and respect those differences with community, only happen in that shell of a conversation during diversity training. And everybody was there because they were forced to be there. And so it starts to become punitive toward the police. And that alone is an impediment to creating some problems with creating the dialogue and the cohesion that we really need to see between police and community. So if I were going to offer some advice to law enforcement agencies about how do you start the conversation, it would be first to change the dynamic of the conversation. Move from police are biased, racist, militarized fighting machines. They're incapable of independent thought. They can't manage their privilege, and they're always bad. And move that conversation, put that narrative aside. We've heard that narrative a lot. And focus on the narrative that police are human, and they're smart, and they're intelligent, and they're fallible, and they can be trained to manage bias just like everybody else can. Then the second piece of advice I would give agencies is practice tolerance and practice active listening, even when it's hard, because it's important that we recognize that really well-intentioned people are sometimes going to say the wrong thing. And it's not because they're biased, it's not because they're engaging in discriminatory behavior, it's because they're human. And as Americans, we haven't had these conversations before, and we've certainly never had them in our workplace. And so for the first time in history, we're really moving outside of our affinity groups, those groups of people where everyone has similar experiences and we have similar perspectives, into some pretty uncharted terrain. And in doing that, we're going to make mistakes and we're going to make missteps. And part of having the conversation about inclusion means being really willing to actively listen. I also think it's important to set goals and objectives. And as part of those conversations that law enforcement agencies have with each other, bring everybody into the table. Bring everybody there, civilian and sworn. Everybody has a perspective and a voice, and think about ways to measure your success in being more inclusive and collaborative with the community. And so you might look at things like reductions in complaints of excessive use of force, or reductions in the number of complaints about officer behavior. Because if we figure out how to manage and utilize community inclusion, then that's going to have another impact on those desirable outcomes that we are looking for. And it might even include things like reductions of overtime, increasing organizational focus on integrity and transparency, like Paul said, whatever that means for us and for your organization, and reducing injuries. And then the last piece of advice I have on this is, when the time is right and the department has laid a foundation for success, involve the community in these discussions. And police are public servants, and the community has a role. And they have a responsibility, and I would argue almost an obligation, to support police by collaborating with them as partners and directing them and helping them establish what are our enforcement priorities. How do we want to see certain policies executed? What should those policies be? And community should have a voice in hiring decisions. So, I always think that the better decisions are made when we approach them from a position of diversity of thought, and that includes bringing the community to the table. We don't get to actual police reform until the community is working collaboratively and in partnership with police. So thank you.
Thank you, Dr. Settles. And I think many of your points apply to a lot of different organizations. So that was wonderful. So the word has come up, and we're not going to avoid it because we had audience questions about this, but the word is defunding. And Dr. Lee and Dr. Taylor both kind of alluded to this. So Dr. Taylor, the idea of defunding the police has created a great deal of controversy and I would say confusion. One of our audience members, Alan, asks, should we defund the police? Can you clarify what this means and how it might impact the community? Is defunding, or I think as Dr. Lee mentioned, reallocation of resources may be a better way to look at it, but I'm gonna let the panel, I'll start with Dr. Taylor on this, and then Tanya or Jesse, you might want to jump in on this conversation. So, Paul, you get the onus here.
All right. So, like I said, defunding is kind of the latest buzzword, right? That a lot of people are throwing around, and everybody has heard the term, but everybody has different meanings for it. And some people I've talked to have said, you know, defunding means basically dismantling the local police department. We're not going to give them any funds. We want to disband the police department and build something new. Others have talked about, and I think probably the most popular way of looking at this is we're going to decrease funding to police departments while increasing funding to social services and other needed support systems within the community. My fear with the defunding efforts that are being pushed forward now is that a lot of state municipal governments are facing huge deficits in their municipalities, their cities, their states, their counties. There is a pressure on them to, quote unquote, defund the police. And the initiatives that are being pushed forward are taking funds away from the police without increasing funding for very needed social support networks and institutions within communities. In my mind, that's a disastrous proposal, because what we're talking about is taking away the current resource for dealing with these issues, though it may be flawed. So basically reducing training, reducing personnel for departments that in some cases are responding call to call to these types of incidents without giving funding to the needed social support systems. In concept, I think it's really important. I think that if we were going to push something like this forward, that clearly defining what the police role is, right? So the police being the coercive arm of government is not appropriate for a lot of the roles that we've asked them to fill, right? So walking into a situation where your only tools for dealing with that situation are arrest or referral isn't necessarily the best recipe for a good outcome. And so if we were to increase those social support networks and those institutions within communities, that would be ideal, while clearly defining the police role. But what I see being pushed forward in a lot of cities is just the removal of that funding, having overworked officers with less training on the street, facing an increase in homeless issues and people facing mental health issues related to COVID-19. And what we've seen is a recipe for disaster going forward. And I would say it's also an empirical question. There are ways that we can go about this where we increase social support, we increase social networks within a community while decreasing our police resources in that area. And we can look and see how these things work without completely defunding a police department with no backup plan in place. And so I think these ideas are good ideas to be talking about. We need to clearly define the term that it is we're talking about, and we need to do it in a way that's not politically driven. We need to do it in a way that is thinking about the possible outcomes and accounting for those moving forward.
Dr. Lee, yeah,
definitely. When we talk about those reallocations of social services, it's been my experience that most of those agencies are overtaxed already themselves. When we look at additional social work responding to typical situation where law enforcement officers would respond to. Individuals that I have spoken to in the field, they have a shortage themselves. So I don't know where we find those resources by reallocating those funds. We have to educate the process of licensed social workers. A lot of the individuals that we would need having the funding to receive the licenses that they need. So I can understand reallocating funds that help educate those individuals to transform into law enforcement, but there needs to continue to be joint training, development of those individuals. Not only that, it's going to pull away resources, as we talked about, community policing. If they're chasing the call for service, then there's lack of time for community policing. So instead of increasing the opportunity to talk, we're actually moving away from that again. So we're looking at trying to enhance the philosophy, not a practice of community policing, but the philosophy. We need to have that communication. When I look at training being cross-training, meaning that we're not going to have police training with police all the time, but have them work with HR in the county, have them work at the university, have them work other places where you're doing joint training. Now we're sitting in classrooms across from each other. When we do our sensitivity training, it's not just a bunch of cops. When we look at implicit bias training, it's not just the community. We have this cross training and pollination. So what it does, it allows us to have open dialect in an environment that's not controlled or dominated by any one particular group. That's going to bring about the communication. That's going to bring about the opportunity to have real talk, real conversation, and we get to peel down the walls. Individual community members get to see that police officer at the end of the day is a community member. My first experience walking around in Denver, everybody thought I was an NFL player. I was just walking from one, almost everybody in the world wanted to stop me to give me a ride to the mall. But at the point I'm trying to make, that people will embrace you. And it gave me an opportunity to talk to individuals that I would not have by just walking to the street. Instead of taking an Uber or a cab, I just walked the neighborhood. And during that short period of time, I met and developed new friendships in Denver on a very short visit of 2 weeks.
That's great.
The more we can put police officers in the streets and with the community, we're going to have better communications. The more we chase from call to call, again, we're going to have the division even more. It's going to be a wider gap.
Thank you.
Can I add one other thing?
Oh, go ahead.
I'm sorry, Mary. The other side to that is that we need to create that space for a different practice. One of the examples that I use is if you take a person who has the best of intentions and drop them into a Department of Motor Vehicles department anywhere in the country, after a very short period of time, they're going to act like everybody else in the Department of Motor Vehicles, right? Because the environment, the job, how they interact with the public kind of shapes the way that they do business. If we continue to have police officers respond call to call, it doesn't matter if you call them peace officers, it doesn't matter if you call them police officers, they will begin to interact in the same way, right? Because we have basically the same roles for them. And we know when we drop people with similar training and similar experience into similar situations, they begin responding in very similar ways. We know that from the social sciences. That's why we can use statistics to study things. And so we want to kind of reshape that interaction if we can. We want to create some resilience around that response so that officers have the ability to be human beings, as Tanya talked about, so that we can have those human interactions. And I love what Jesse said about sitting police officers and community members down together to talk at an equal level. Too often, it's officers standing up, talking about their stories, or community members talking about their concerns. In my experience, when you have them sit down in a classroom, across a coffee table from each other, that's when real conversation and real progress is made.
Oh, that's great. Thank you, Paul. So you both had mentioned the idea that many of the things that we face are empirical questions, and that research is going to be required to see how it works. Dr. Lee, one of the things that we have, which is a constant concern is how we collect data and do research. And I know that you work at a global and national level. We also have local issues. But can you describe the research data that helps inform us and how you disseminate that kind of information? Many people are not going to pick up an academic journal and read an article. No offense, Dr. Taylor, and to myself, but how can we have accurate data on police contacts, use of force? What exactly is going on? Dr. Lisa, could you, and then maybe Paul might want to comment on my comments, but let's start with Dr. Lee and see what you have to say about research and empirical questions.
One of the things I will say is that we do a great job in collecting data. We collect data probably second to any other country. The problem is we're probably the worst in disseminating the information out that can be regurgitated. So one of the things that I try to do, as I stated previously in other discussions, we try to work with the community to understand what their reading level is in that particular community. You have to be able to get the information and the data that the individual at the lowest level of education can understand and articulate the information, and the person at the highest education level can articulate and understand. They need to know the reason behind the information. We're not just collecting data just to have data. What is the purpose? And it has to be purpose driven. So when we talk about a lot of oversight boards and community oversight boards, one of the things that I look for is that we need to have more community data-driven teams where the community understands the reason behind the survey. They're part of developing the data collection so that they understand it. Most people, it's a matter of building trust and equity in the numbers and the data. So the best way to do it is to be a part of it from the beginning. So if you include the community on why you're collecting the data, the purpose of the data, and what is the purpose afterwards, what are we going to do with this data? Or are we just going to collect it, put it on a shelf, and do nothing with it? Or are we going to make some type of social change with the data we collect? We talk about police department using data-driven policing, so they know how to police. Well, I see police departments collecting the data and still not applying the data to the policing model that they said they're going to do. And they find out policing communities or over-policing communities based on what they perceive to be an issue. When we talk about reallocation of resources, maybe that's it. You know, we have latchkey kids. We're looking at the data, but we're not looking at it in this whole total collective. Maybe it might need to go towards school resources, where after school programs, so that we know that if we have crimes between 4 and 6, while parents are still at work, then maybe we reallocate funds to provide law enforcement personnel to work overtime at the schools, serving as coaches or directors. We're reallocating the sources. At the same time, we're developing relationships so that we pay the insurance that the schools may require to have the schools open after hours. Those types of things that we're still utilizing the police, engaging them in community activities, letting the students see these individuals in a way that they're more in light. And this is how we look at the data, how that data is going to be utilized. So when we look at reallocating funds or defunding, we need to be able to see the data that supports how these resources are going to be utilized and allocated before they start taking money away, to balance budgets or furloughing individuals. So definitely the data really means a lot. How many officers do we need? The old model about per population is out calls for service. What are our response times? Data means a lot. It means a lot to the community because they're sitting there saying it took the police officers 5 minutes to get here, but we reallocated funds, so therefore the calls of service may go up. So by looking at the data, we'll understand these resources, but we need to let the community know that by reallocating the number of officers, these are expectations that you need to expect. So communities that may be overserved may not longer get the service they need, or the time to respond to these services will be even longer.
Paul or Tanya, would you like to add anything to that?
If Tanya doesn't, I just to add briefly, and Jesse touched on this, when the data collection effort comes from the outside, and this has been supported with research in healthcare and other places, it really doesn't have an impact on outcomes. And we talk about transparency, and we think of transparency as data collection and having access to more data, but that transparency does not necessarily equate to better outcomes. At the Cleveland Clinic, so where there was a massive healthcare effort to start to collect data and actually start to kind of demonstrate which doctors, which clinics, which practitioners were having bad outcomes, in an effort to draw attention to that and hopefully improve outcomes going forward, they found nationally that it didn't really have an effect. Well, in the Cleveland Clinic, they actually took that on board and they made it a personal mission for the individual doctors, for the nurses, and they used the data collection to inform individual practice in the direction they were going. There, they found tremendous success. And so there's a need to internalize what that data means for practitioners and to make it meaningful at the practitioner level, not just coming in from the outside. As a state, we're going to collect and publish data. And yes, the public maybe becomes more informed about what's happening, but that doesn't have an impact on practice until it becomes meaningful to the individual practitioner, until their practice is informed by data. And that's where we're getting at true evidence-based policing. Prior to this, it's kind of been a global perspective that we put forward these evidence-based practices and policies and programs, but at the individual practitioner level, we're policing the same way we've always policed. Where we can actually have an impact is where organizations take that data to heart and start using it to inform their individual practice.
Great, that's exactly right, and I think we'll see that given the mandate for data collection in the Colorado reform police bill. So thank you. Yeah, Tanya?
I do. I think that Paul and Jesse have both made really, really important points, and that we hear a lot about the public asking, well, why do you not have that data? Don't we have any data? I need to know the data. I need to understand what the data means. And data itself doesn't necessarily mean transparency. It doesn't mean that you're going to get the information that you need as a community member. And I think, too, that there's a risk of making some bad decisions about policing that are actually discriminatory in nature and hiding behind the data that would support making that decision. Hotspot policing is coming to mind as an area of risk where that can happen, where there's over-enforcement that is strategic, theoretically, of certain areas of a city or a town or a jurisdiction. And the police can hide behind the data and actually engage in bad behavior that's not what the community is looking for. And I don't think that they do it on purpose. I think that they're trying to make the best decisions that they can, but we are inundated with data that we don't use, and we don't use it well. So data with a purpose is good. Data that just exists for data's sense probably isn't really helping us all that much.
Yeah, I think you're absolutely right, and that flows well with what Dr. Taylor had to say. So Tanya, let's see, did I get mixed up? Probably no. While I have you on here, can we? One of the topics that came up is recruitment and hiring, and I just see in the chat room that this idea of leadership and how important that is, but many of these questions, Rachel, for example, asked if a better vetting process can be implemented for hiring. Similarly, Elizabeth asked, how do we get good cops on board and implement culture change? Is it possible without defunding and by using improved training? The other, of course, important aspect of the questions that came in, what role would education play in making some changes? And I know I just threw a whole bunch of questions, but they center around the same idea. What can we do toward culture change?
Yeah, I think that's really what we're talking about is culture change. It's not throwing all of the officers out and bringing new ones in. And as an alum, I'm kind of a big fan of education. So certainly there's a role there, but that police culture, it is a really, really tough nut to crack, because it means that officers, and Paul talked about this a little bit in some of the things that he said, and Jesse as well, that sometimes police culture means maintaining a code of ethics that is a very, very different from the official code of ethics. It's really different, and it means supporting this them versus us mentality, and in some cases, actually pitting communities against the police, and regrettably, diverse communities in particular, so that the community becomes seen as the enemy to the police, and then the police are the enemy to the community, and we never actually get anywhere good after that happens. So to implement change in policing, you kind of have to start with the officers themselves. We can talk about high-level decision-making and executive orders and direction from leaders to get us to a change in the culture of policing. But if we don't ever actually get to those officers individually, we don't get anywhere, because we want to be able to create a culture where an officer's values are aligned with the organizational and operational and community goals. We've heard a lot of impressive results about reorganization and culture change in policing, and I know that Dr. Lee is going to cringe when I say this. We've talked a lot about Camden, New Jersey, and I don't recommend that we take that approach to every department. In fact, I think it's actually a pretty bad idea, and it might have worked in Camden. But like Dr. Taylor said, not every solution is going to work in every single, every scenario. Every department has to find the right path for them. So I'm a little bit critical of let's fire them all and make all of the police officers reapply for their jobs, and that'll change the culture. Well, it worked in Camden, but it's not necessarily going to work in Lakewood, and it won't necessarily work in Denver, and it won't necessarily work in Aurora or Grand Junction or Eagle or any of those places where we're serving people. So to really get to change, I think we need to focus benefits on the officer individually. The officers need to understand and internalize why the change is good for them. So when we talk about the roles and responsibilities that officers and civilian employees have in agencies, it's really one way. It's sort of the agency says, this is what you're going to do, and in exchange, we're going to keep sending you a paycheck. And so there's that transactional element to it, but they don't ever engage in change. And so that perspective is actually pretty short-sighted. So until officers begin to understand that interacting with the community and understanding bias and dealing with implicit bias and the profiling by proxy and all of those things that happen that we've seen police encounter lately, that using those tools, training in those tools are just as important to them as any of the other training that they receive, like firearms or driving or investigation skills. Understanding bias and retooling and rethinking what that relationship looks like with the community actually brings us to a place where officers are safe and are a little bit safer. They're never going to be completely safe. I'm not totally naive. But they'll be more effective in their work, and they'll be able to avoid those bad encounters. And we do need to seek diversity in recruitment. One of the most common criticisms in academic literature and in practice, and we're hearing it now, is that police departments demographically do not represent the communities that they serve. And that is frustrating to people. So my solution to that is partner with the community and find out what they want in terms of recruitment and promotion. It's not always necessary to focus on demographic factors, but we do need to focus on diversity of thought. And if we partner with communities and we find out what are the characteristics that you're looking for, and then ask them to help. Let's look in places to recruit officers that we haven't looked before, and use the community, utilize them as a tool to help get us to the right populations of recruits in the future. Look for a diverse pool of candidates. Look in places that we haven't traditionally examined. Not every police officer needs to have military experience, but maybe we want to hire teachers who are looking for a career change. But talk to the community and use that resource. And I think that that will actually help us get a really long way. Some of the places where we've done work recently are really not diverse communities. They're communities where the population is 95% white. And how do you create a diverse community? Well, you don't necessarily focus on race as the sole factor of diversity. So maybe that helps.
Yes. Jesse, could I ask you to maybe pop in and give us an overview of the difficulties of culture change and some of the things that Tanya touched on?
Yeah, and again, yes, as Tanya mentioned, I was cringing a little, but when we talk about cultural, I've seen culture will eat up a policy any day. If you go into an organization when the culture is so strong, you can have the best policies in an organization, and that culture will just eat up that policy. You have to make change. In certain areas where I might have did management studies in a lot of different organizations throughout the country and some international, I seen where the culture was so strong, where they brought in strong leadership. And these leaders were successful in so many places. And for some reason, that agency's culture would continue to outride this thing. So I have a few things. We focus a lot on recruitment. And life happens. As you say, you can drop an officer into an agency and they will conform to what the culture of that organization is. If you have a field training officer who is a part of the negative culture, you need to modify those behaviors. Sometimes you have to reach and come back and bring someone up from a lower end. So even when it looks at indicators, performance evaluations, performance, everything that we do, we need to make sure that it has a purpose. You don't have a performance evaluation just to check off the box. If you want to change behavior, you want to make sure that the performance measures meet the direction of the organization. The mission of the organization may have changed over the last 3 or 4 years, or it may change within the next 6 months. We've had a pandemic that changed the mission of the organization, where we've actually put policies out to not make any arrests that are not felony convictions. That's an organization change that took place overnight based on the environmental things that took place. So as an organization, we need to be flexible. We need to have the ability to be able to change as necessary. Our policies need to reflect those changes. So as soon as we need to make change, our policies need to reflect those. And we need to make sure that everybody understands the policies. So one of the things that we talked about, and I think Paul mentioned earlier, there can be 2 policies and 20 different interpretations of the policies. We need to have ways to quantify that. So I have no problem that if you take a test 10 times to understand, this is where we want you to understand this policy goes. We're not doing that. You got a policy, you sign off on it, and then you go out and you interpret it any way that you feel that works for you. We need to make sure that, and they're looking at national policies instead of individual state policies to a certain extent. If we can do that, we're training standards and similar laws on at least the major things: use of force, implicit bias, diversity training, that there is a standard across the boards. And then we have a way of making sure that everybody understands what those standards are. If I interview 15 people on what community policing is, I'm going to get 15 responses. But going back to the recruitment process, there was a program that I was involved with the Justice Department. They had a program called Screening In versus Screening Out, hiring in the spirit of service, if you want to look it up. And what they did was they looked to screen people in instead of screening out. Currently in law enforcement, we look to screen people out. And so therefore, there were individuals, they might have been in college. And I'm not your typical person where I never drank, never had a cup of coffee or a cigarette, but there might have been people that experimented along the way while in college. But now they've changed their ways and they want to go in law enforcement, and before they would have been screened out. But they have so much value to offer, and they have their degree and they want to do great things, and they can present a lot of things to us. that was the screening in process, that we're not screening them in because what they did bad before. We're looking at what over the last 5 years or 10 years they did to change their life. And those individuals that we went back and did the study wind up becoming Officer of the Year, Sergeant of the Year, and they wind up being more community involved because they look to screen in those individuals that were engaged in their communities, and not necessarily just wanting to be a cop to carry a gun, but they wanted to do good for their communities. I wanted to be an accountant. I had no desire to be in law enforcement, but because I had coaches and football coaches around me, when I ran into a negative officer, they gave me an alternative, that if I wanted to change it, I needed to be involved, engaged. Then when I got engaged, I understand that wasn't enough. So then I needed to be involved in a nonprofit organization to give me a voice, because I was too young to have a voice within the department. And that nonprofit gave me a voice that I would have never had. I wouldn't be where I'm at today if it wasn't for a nonprofit organization. So I encourage everybody, I don't care what job you have, what career path you take, engaging in a nonprofit will develop you the skill set. So I encourage every officer, once they're in the department, to engage with a community-based organization. That gives them that opportunity to be broaden themselves. I also believe in, we do a psychiatric review, enter the department, that after 5 years or so that we should go through a review process, because life happens, loss of family, divorces, life situation, things change individuals socially and mentally, that they should have an evaluation process. And I think a lot of times that, and it has to be laws change, because even in the military, if you go to seek some type of help, you're listed as damaged good or perceived to be damaged good. So officers that may need to seek that assistance may not. So when we're looking at policies and things like this, it's not only recruitment, we got to look at the retention. And if we're looking at retention, we want to make sure we retain those healthy, mentally sound officers. And those who need help, seek and get them the help that they need in a way that they will not be classified as damaged goods, but we're going to rehabilitate them if they can. And if they cannot be rehabilitated, help them find new sources of employment.
Any responses, Paul or Tanya?
Yeah, if I could add to that, fundamentally, law enforcement education in the country is broken. I am convinced of that. A 6-month academy at the long end of our nation's training programs is not enough. And I equate that in my criminal justice classes to somebody who's never played basketball before in their life, sitting down for 6 months and learning how to shoot from the free throw line, learning how to dribble around cones in a completely separate class, and then sitting through PowerPoint after PowerPoint telling them the rules about the game. How prepared would they be for a basketball game at even the high school level? And the answer is they wouldn't. Our expectation is, with all this siloed training in a 6-month period, and now we're cramming more and more and more into that 6-month period, with all that siloed training that's completely separated, is really never put together except in a few scenarios in some jurisdictions. It's never really put together until an officer hits the street. And the expectation is that all of that's going to come together and the officer is going to be able to perform. Now, there are a lot of officers who get really good at their job. And Jesse's talking about, some people seek continued education, some people seek out exposure, some people seek out opportunities, but currently there's no track that ensures officers get that exposure. There's no track that ensures all those different training silos come together, so that when an officer is facing that rare but highly complex critical incident where they have to make split-second decisions, and all of those classes come together, their communication classes, their use of force classes, their legal and law classes, their understanding about community relations, all of this comes together at a head during a highly complex decision environment. And we're expecting this training to come together and end in good outcomes. And what we see, and I think what we haven't researched very well, is how the job changes officers. We've looked at differences in policy, and practice as deviants, as officer deviants, that the officers are kind of, they're trying to get around the system, or there's a culture that gets, but have we actually trained them? And handcuffing is the example I used, and Jesse can speak to this. How many officers actually handcuffed the way they were trained in the academy? And I don't know of any officers, when I look at them on the street, or myself, that handcuffed the way they were trained in the academy. Why? Because the training didn't align with what was needed. If I did the handcuffing technique I was trained in the academy, the first intoxicated person I tried to handcuff would fall flat on their face. And so I have to modify that. And how does that modified practice play out over a 15-year career? How many, and bring up a controversial topic, how many necks did Darren Chauvin kneel on before we had this bad outcome, right? And prior to that, maybe they were good outcomes for him to that point. What was the system that led that officer to get where he was in that moment? We need to understand that. And currently, our system isn't looking at that. Currently, our research isn't looking at work as it's done. It's looking at work as we imagine it, as we want it to be. But we need to understand how it's done and how to prevent that next one. We're not going to prevent all of them. And the other side to that is, we need to have policies that take into account the fact that human beings will be human beings. How do we respond when the bad outcome does happen, right? Because it will happen. Hopefully we can reduce them. How do we respond when it does? Do we go to the family of somebody that we've shot and killed? And do we say, you know what, we've done a 14-month investigation and we found that there was no crime and no policy violation? Can you imagine if we did that in healthcare? If we killed somebody in a hospital and the hospital administrator came out and said, we investigated this thoroughly for the last 14 months and our doctor didn't commit a crime and a policy violation. Okay, but how did it happen? How did we get here? And how are we going to prevent it from happening the next time around? And I think that's where we need to start to get to with both our policies and our research, and looking at how we carry forward practice.
So I'm going to throw out a question that you're not prepared, you're probably prepared, but one of the things that the Denver Police Department does is they have an early warning system so that they can track officers throughout their career. And if they make a mistake, or they may need some, they can tell there were too many accidents in the car, they need extra training on driving. So is that a method that can help us? And I'm just going to throw that out to the panel because I know you weren't expecting this.
Yeah, Paul, you can go. My response is early warning systems are as good as the first line supervisors. It can be there. It can be an oversight. They're doing so many different things. It has to be one of the things where your first line supervisors, sergeants, they have to be on top of that. It's just early warning signs are great when they're utilized for the purpose intended. But as anything else, it can be culture. That, hey, we got them, but we really don't use it. Or it can be political within the department that we won't use this, we won't use that. And then depending what it is, culture, Paul, I don't know if you ever heard this saying before. It's one of the things, you go to the academy, you come out, and the saying, it still cuts through me. I'd rather be tried by 12 than carried by 6. Did you ever hear that? Mm-hmm. Okay, that mentality right there kind of puts a curtail in the early warning sign. You need to make sure you have a strong supervisor that knows how to separate themselves because they just came from the ranks. They still have that little connection with the ranks. And the more they separate themselves from that and become the supervisors they're supposed to be, early warning signs work well. They work great indicators, but if not utilized for the purpose intended, then it's just another process to check off.
Thank you.
And then it becomes more data. It's more of that data that we don't know what to do with. So that becomes a problem. But I think there are benefits to early warning systems. It does help remove that stigma of mental health policing is difficult. It is technically difficult. The technology is difficult to manage, and it is emotionally and psychologically difficult to manage. And we forget, I think, in the community that police see a lot of stuff that is really, really horrible. We see people at their worst. We see people when they've made the worst decisions of their lives. We've seen people at their lowest points. And when you see that for 8, 10 hours a day, for months to years on end, it takes a toll on how you react to those situations. And so I think that there is some good to early warning systems, but like Jesse was saying, if they're not managed well, and if we don't have the organizational buy-in to make them work, they fail, and they just become more of that data garble that we have.
Thank you. So, Dr. Taylor, I'd like to ask you, our audience has a number of questions that were raised about demilitarization. Can you address how this issue plays a role in our current environment, especially with the protests and some riots, and how that if we do demilitarize police departments, how does that change community relationships? And you might start with kind of addressing what that means.
Absolutely. And if I could come back to that just for a second, I'm going to talk really quickly about what Tanya and Jesse said. Those early warning systems are only as good as the metrics that we look at, right? And we put into them. The other aspect of that is, and this comes from the construction industry and looking at safety in that industry, the saying is that death lies in what we do really, really well. And oftentimes those bad outcomes that we see come from things that officers have kind of, their practice has evolved over time, and oftentimes it's behavior that's been rewarded previously, right? So they've made arrests successfully. They've used this use of force technique successfully to quote unquote de-escalate a situation, and they're rewarded for that behavior. And so every agency in the country after this is going to have policies about necks and kneeling on necks and using neck restraints. The next bad outcome that we see in policing is going to have nothing to do with that, right? And so how do we start to capture where our practice is drifting, where we're getting away and we're in kind of a danger zone? There's this, Murphy's Law. There's the other one that a lot of officers operate off of. They say what can happen will happen, right? And so the idea is I'm going to be safe. I'm going to do everything as safe as I can. Well, the opposite side of that is what didn't happen, right, isn't going to happen. And the officer learns the wrong lessons from that, and that you see that practice start to drift. And we actually start to see an increase in bad outcomes and issues, both from an officer's safety standpoint and in a use of force standpoint, right at 5 years, where that practice has started to drift away from, and the officer has gotten comfortable in what it is that they're doing. So our safety, the way that we look at safety, the way that we start to capture those things needs to take that into account. We need to understand work as it's done rather than work as we imagine it or we want it to be. Demilitarization.
Can I just interrupt you before you change subjects, Paul, just for 1 minute? So we're seeing, at least in Denver and Minneapolis, the use of ketamine. Is that one of the things that you could potentially be talking about that would make this change? People have an excited delirium, they're trying to calm them down, and they administer the ketamine. Is that going to be something that we'll look back and say, well, this practice may or may not have been good?
Yeah, I think we need to be looking at these practices, right? Currently, there's no dissemination for case studies in policing, right? So similar to what we have in medicine, where we have a bad outcome and we want to learn from that bad outcome, there's really no equivalent in policing. There's some efforts at the Police Foundation on their near miss initiative and things like that, but there's no real effort to learn across the board about what actually occurred. We take a very criminal administrative approach to investigating the officers, and what does that determine? Whether or not the officers committed a crime or a policy violation. It doesn't tell us how we got there, and it doesn't tell us how to prevent things going forward. And I think we need a new view on that, particularly if we're concerned about outcomes.
Thank you.
Do we want demilitarization?
Yeah, I'd love to hear what you
So demilitarization. Again, this is a buzzword, and it means different things to different people. And I really think that we need to define this. This is an issue that needs to be defined by our society. What is it that we want from our police? All right. If we want our police to respond to civil unrest, then we've got to provide them equipment to respond to civil unrest. Having said that, how the police use that equipment is critically important. And the way that it's perceived by the public education piece, all of that is important. If we want officers responding to mass harmer events, right, and active shooter events, we have to provide them the equipment to do that. The police are the coercive arm of government, but it's where we point that coercive arm and how we use it as a society that's critically important. And that's where, as a community, we need to weigh in. We wouldn't tell firefighters to go into a burning building without the proper equipment, right? And we need to provide our officers with equipment to keep them safe. But again, if they're standing there intimidating peaceful protesters and suppressing First Amendment rights, that's problematic, and we need to address that. If we're actually aggravating, right, situations where there's protest, and the addition of police, heavily armed police, increases that to a riot situation, we need to look at that. We need to learn from that. But at the same time, we had times in Baltimore where police officers had no equipment, and they both were injured and were not able to assist when things got very violent and things were getting destroyed. So there's a balance there. I think we need to define what militarization is. I think in academics, we've put forward a lot of hypotheses about what it is. People have written about it extensively, saying we think this is a bad thing. But at the same time, we really haven't tested these things. We haven't looked at them. We've talked about SWAT teams and the increase of the use of SWAT teams, but we haven't really looked at how SWAT teams have also been used to contain and de-escalate really violent situations in which police could not really have an impact without using high levels of force before. And so I think this is a conversation we need to have, and it comes back to what our expectation for the police is. If we don't want the police engaging in situations where there's civil unrest, who will engage in those situations? And I think we have examples of that going back through history. Governors, mayors, political leaders from the beginning of time have always sought to suppress public rebellion, right? And they've typically used the military to do that. If it's not going to be the military who does that, do we want our police officers to do that? And if we do, I think we have to provide them equipment. But again, we need to have conversations about what that means.
That's great. Dr. Lee, did you want to chime in on this? Because I was reading your body language, and I thought maybe you want to talk.
I did. One of the biggest questions was, it just came to me, being able to determine what is a protest and what is a person who's rioting. And it just came to me that me and the rabbi across the street, we wanted to walk up to see the protesters walking. And a lady pulled up to us and says, "Don't go that way, they're rioting." So I asked the lady, are they rioting or protesting? And she got mad and drove off. When we went up there, everybody was in a very civil order. And the police department were marching along with those individuals. So leadership plays a role, and how we dictate and terminate. So this is where leadership really comes in on the police department. And the higher the leadership, I think they can actually control and de-escalate situations. Someone once asked me, can we have community policing in the midst of a riot? Absolutely. Most people just want to have their voice heard. Let them be heard. Find out what they want and then go from there. But we need to make sure that if the community wants to be heard, let them be heard. That's when the anger comes in, when individuals are stifled. Even in higher education, we're stifling our students to have a voice when this is where they were able to have the educated argument in a way that's controlled so that we can go out and do social disobedience in a way that is going to benefit us all in the long run. A lot of the changes that will take place are going to benefit police departments, going to benefit the community, but how we go about it. And just because someone protests doesn't mean they are a rioter, you know, and I think that's where the big problem is. So how we use force with force, I think that's a big decision. I mean, it's okay to have them in the background when needed, than not have it, but to be engaged in it. I think that when you looked around the country, those individual agencies that interacted with the protesters had a better outcome than those who provided force. You know, that's my personal view.
That's great. Tanya, would you like to say anything about that issue?
Yeah, you know, I think that there's an element here where we also don't know what we want police to do. In the community, we have no idea what police do. So I was talking with my brother. My brother went firefighting. I went law enforcement. My mother was thrilled with both of those decisions, and I'm rolling my eyes a little bit. And so my brother said, as a firefighter, you know exactly what your job is. If you are a paramedic or an EMT, you know exactly what your job is. And if you're a community member, you know exactly when to call one of those groups of people. But police, you don't know what your job is. And it's a moving target, and it varies from place to place and city to city. We have police doing things that, you know, really as community members, we should be taking responsibility for ourselves. Do you really need a police officer to go contact your neighbor because the dog is barking? Do you really need a cop to do that? And yet they do it. They won't say no, and which is to their credit. But I think that police generally are experiencing sort of like this giant social mission creep. And we no longer know exactly what it is that police do. No wonder that we're investing in making sure that they have tools, including, you know, including military style tools, because they don't know what their job's going to be tomorrow or next month or next year. And communities, we need to help police figure that out.
Okay. So we have about 10 minutes left, and I'm gonna switch to some of the questions from the audience. So surprise, but one of the things that I don't think we've touched on, and Sari, who is the managing editor of a journal called Crime, Law, and Social Change, she brings up the idea of body cameras. Well, are these going to be helpful? Is this one of the solutions? And it's, you know, how do we store the video? Who has access to the video? The Colorado bill has addressed this, and we'll have all officers wearing body cameras. But one of the panel can give their thoughts about body cameras. Tanya, you're Dr. Settles, so I'll just start with you.
I had a couple of researchers.
Okay.
Body cameras to me have now become a reactive tool. It's more of an investigative tool. It's almost like a numbness effect. When they first came on, people were anxious about wearing the cameras. Now you wear the camera, and we're getting all these incidents captured on camera. It's because people just get numb. They're wearing the camera. If you're gonna do what's right, they always say that, you know what? If you're you're going to be ethical when nobody's looking, or if somebody's looking, you're going to be the same way. So those who have those ethics, cameras mean nothing. They're going to go about doing their job. Those who have ethical issues may have challenges with cameras, but people have a tendency that with the body-worn camera, for us as a tool now, it becomes more of an investigative tool than a preventive tool. It doesn't prevent people from doing things wrong, because we know people walk in the stores, they rob, they know the cameras are there. Police may overreact with body cameras on. That's why it's filmed. Everybody has a cell phone. I have a 2-year-old granddaughter that uses a cell phone. She's walking around recording. Everybody has a cell phone. We're being recorded 24/7. So the cameras now become more of a numbing effect. They're there. It's a part of life, and now became more of an investigative tool than a preventive model. So, Paul, any difference?
Yeah.
I'll let Tanya go.
I think. Thanks, Paul. So I think that the issues behind body-worn cameras are more complex. People feel like there's a certain amount of safety, and it's sort of like a security blanket in body-worn cameras. And I'm not opposed to them, but we do have to think about things like, okay, if every police officer in the state is going to wear a body-worn camera, where are we going to put all of that data? If we have all of that video data, what are we going to do in the departments to mine that data and use what we find effectively and usefully? Otherwise, we're just waiting for a subpoena to show up to produce the evidence for a court, event down the line, for some trial down the line. We also have to answer big questions like, how long do we retain body-worn camera video? Do we make it available to the public? The public will tell you that body-worn cameras are viewed as being one of those markers of transparency, but that's only if they have access to the video that they contain. And that's only if the video is retained long enough to actually be useful to the public. A 72-hour destruction of video doesn't really help anyone. Paul, what were you going to add about that?
Yeah, and I think this comes back to the idea of transparency and the thought that if we can see it or if we have evidence collected on it, it's going to somehow change outcomes, right? It's going to somehow change behavior. And the evidence shows that really doesn't have, it has a short-term effect. I think around 3 months to a year effect on actually decreasing overall use of force events. And then it goes back to exactly kind of where it was before. So it really doesn't change outcomes. And the other side to it is that if you're recording every contact in real time, that's just more data. You're not going to have a department the size of Denver PD who reviews every hour of footage you would have to have the same number of employees working full time as you have police officers out on the street. And that's just not, it's just not possible. So it is a reactive tool. I think there's tremendous opportunity on the training side to use body camera footage for new recruits in the academy to demonstrate how good law enforcement is done. Again, academy recruits typically don't see police work until 6 months after they've already, they've been employed. And so starting that early and demonstrating what good police work looks like in your agency would be tremendous in the academies, and probably should be done for every module that you go through with a decision element for recruits. So I think there are some opportunities from a supervisory standpoint. If you were engaged as a supervisor, you could use body cam footage to review what your officers are doing. Does that happen across the board? No, it doesn't. And part of the reason is time and resources, and it's really expensive. So I think some of what we've seen is that's been used to increase conviction rates. It's used to suppress complaints and in some cases suppress conversations. So when somebody comes in and says, hey, I'm complaining about this officer, the response now is, well, we have body camera footage. And rather than kind of taking the time and sitting back and saying, well, what are your concerns, and turning that into a conversation, in some places it's been used to suppress that conversation. And so I think it's a double-edged sword. I always say that patrol policing is the most visible profession out there. I mean, they drive around in a marked patrol car, they wear a uniform. The public generally sees what they do, and with cell phone footage, most of that's being captured anyway. We're really not changing that dynamic too much with body-worn cameras. And cameras take interpretation. People think that they show an event, and they don't. Just a little bit of research that I've done on that. Changing one word in the way you frame body camera footage completely changes the way people interpret that body camera footage. And so I think it's important that we understand the limitations and that it's not a panacea for changing outcomes in policing.
Wow, that was wonderful. Thank you. So I'm watching the time, and we have I had looked at we have so many questions that we're unable to answer. And I know that if there are questions that you'd like us to follow up on after the webinar, some of us would be happy to do that for you. And just real quickly, one of the main themes that I see in many of these questions is about community policing. Do we still have community policing, and will we continue to have community policing? I'm not sure there's an answer to this, but real quickly, can we just kind of look at that concept of community policing under these current circumstances? Paul, I've got you up.
All right.
I'm sorry.
Yeah, again, I think we really, it's a term, right? And we really need to kind of change that from community policing to community engagement, I think, and community conversations at all levels. It's not just a police chief saying we have a community policing program and assigning some officers to do community policing. It is a philosophy, and I want to reiterate what Tanya said. I talk to a lot of groups of police officers. I talk all across the country, and when I have an opportunity to talk to them, one question I ask is, what is the fundamental role of policing? And the crickets that come after that are incredible. I typically get the LAPD motto, protect and serve, right? But what does that mean? And how does the individual officer interpret that? And I think if we're really going to engage and move forward, we've got to provide a community policing model for these officers, a mission for these officers that's clearly understandable, that when they drive out, when they drive their patrol car out at the start of their shift, they're not just thinking, what is this night going to bring, right? They're thinking, how am I going to engage with my community tonight? How am I going to further the mission of my department tonight? And this is the direction we're trying to go. For me, that would be a fundamental change in law enforcement. As a young officer, when I first started, it's thrilling to start the night not knowing what's going to happen and just reacting, right? But I think policing has been reacting for far too long, and they need to take an active engagement role in their communities. If that's what community policing means, let's push that forward. If it's what we've been doing, I think it's a broken model, and we need to address it.
I think we do still have a place for community policing, but I agree with Paul. We need to reconsider what that looks like. If you ask police departments 20 years ago what community policing looks like, they would point you to a storefront and say, look, there's where our community policing is. And we had officers who played basketball with people that they thought were gang members but probably weren't. And we said those are our efforts in community policing. Well, I think community policing is something really different. I think community policing means we elevate the community to the same level as the police, and they work together collaboratively to solve problems, to identify what those problems are and then solve them. And we stop being, we stop being lollipops. That is not what we're intended to do. So there's a place for community policing. It just needs to be reimagined. And and we've started some of that work. It's not gone. It's still here.
Right. So Dr. Lee, can I go back and ask you for kind of the last word, wrap up, whatever you would like to add to the final part of this?
Yeah, well, I'm just going to, the one part that I was going to talk about the community policing part, that it keeps lacking is that as I travel around, people saying they have community policing, but they don't have any cultural awareness of the communities they're policing. That becomes a problem. I know people don't like when I mention the military, but nobody gets deployed out of this country until they go to a community, some type of cultural awareness of the place they're being deployed. So in a city, whether it's Denver, Colorado Springs, or whatsoever, the communities are going to be different. So a police officer policing from one area to another needs to have some type of cultural sensitivity or awareness where they're going to police. And when we talk about community policing, I keep seeing a lack of understanding of the community they serve. So that's why that little hang up was there, is that, you know what, we continue to talk about community policing. We have community programs, we have initiatives, but the philosophy, do I really get to know and be aware of the community I'm serving? For me, law enforcement is one of those things where the best recruitment is the best interaction that I get to interact with those officers. As a young person, 7 years, Little League sports, I had coaches that were all law enforcement people. That was community policing to me. They didn't treat me as one of their ball players, they treated me as one of their kids. So therefore, that relationship not only went through those years and those years in high school, but even when it came to my law enforcement career, those individuals stayed with me and made sure I advanced up through the ranks and where I'm at today. And it took a diverse group of individuals. No one particular group of individuals got me where I'm at today. it was a whole family of different people that believed in me. They knew my culture, they knew me, and they took the time to know me. And until we get back to that, we will truly have community policing. Other than that, we just have policing.
That's a wonderful note to end on. I'd like to thank all our panelists, Dr. Settles, Dr. Taylor, and Dr. Leifer. This has been a conversation I think we could have all day. There are so many issues and points that we'd like to make, and hopefully we can do a follow-up. We have great response from the audience and many questions, but thank you very much for investing your time in this important, or lots of important topics.